This is a summary of Dr. Stuart McGill, Build a Strong, Pain-Proof Back, where we break down the key insights, ideas, and takeaways from this content, giving you the gist so you can decide if you want the rest. Introduction. In this episode of the Hubermanlab podcast, Dr. Andrew Huberman speaks with Dr. Stuart McGill, a world-renowned spine biomechanist, about how to build a strong, resilient, and pain-free back. Dr. McGill has spent decades researching the causes of back pain and developing evidence-based strategies for rehabilitation, injury prevention, and performance enhancement. This episode explores the biomechanics of spinal health, why many common exercises can harm the back, and the best methods for preventing and rehabilitating back pain. The discussion explores the root causes of back pain and why so many people suffer from it, how poor movement patterns contribute to spinal injuries, why traditional core training, like sit-ups, can be harmful, the best exercises for building a strong pain-resistant back, how to modify daily movements to protect the spine, the role of posture, breathing, and bracing in spinal stability, how elite athletes train their backs for maximum performance and longevity, why back pain is so common, and what causes it. Dr. McGill explains that back pain is rarely caused by a single event, but rather by repeated poor movement patterns, excessive spinal loading, and improper mechanics over time. Key causes of back pain: repetitive bending and twisting movements that overload the spine, prolonged sitting and poor posture leading to disc compression, weak core muscles failing to support spinal stability, improper lifting techniques causing excessive spinal flexion, inflammation, and nerve sensitivity from chronic strain. Why many treatments fail. Generic rehab programs do not address individual movement patterns. Pain medications only mask symptoms without fixing the root problem. Many traditional core exercises actually increase spinal stress. Key takeaway: back pain is often preventable with proper movement, posture, and strengthening exercises tailored to individual needs. The truth about core training and how to strengthen the spine safely. Dr. McGill emphasizes that the traditional approach to core training, e.g., sit-ups, crunches, can increase spinal disc pressure and contribute to pain. Instead, core stability should be the primary goal. Core training myths and mistakes. Sit-ups and crunches cause excessive spinal flexion, leading to disc injuries. Heavy back squats with poor bracing mechanics can cause spinal compression. Stretching the lower back excessively can make pain worse. The best core exercises for a resilient spine. Dr. McGill recommends core stability exercises that protect the spine while enhancing strength and endurance. The McGill Big 3 foundation exercises for spinal health. Modified curl-up builds core endurance while minimizing spinal flexion. Side plank enhances lateral core stability and reduces back strain. Bird dog improves coordination, balance, and spinal control. Other effective exercises: farmer's carry builds grip strength, posture, and full body stability. Dead bugs encourages core engagement without spinal stress. Hanging leg raises, if performed correctly, strengthens the core without excessive compression. Key takeaway: core training should focus on building spinal stability, not excessive movement or flexion. How to modify everyday movements to prevent back pain. Dr. McGill explains that small changes in posture and movement can make a significant difference in protecting the core. Best practices for daily movement. Avoid bending at the lower back when picking up objects. Hinge at the hips instead. Keep a neutral spine during activities like sitting, lifting, and standing. Engage the core and use proper bracing when lifting heavy objects. Use lumbar support when sitting for long periods to maintain spinal alignment. Breathing and bracing for spinal stability. Proper breathing techniques, diaphragmatic breathing, enhance core engagement. Bracing the core before lifting prevents excessive spinal motion. Key takeaway: spinal health starts with proper movement mechanics in daily activities, not just during exercise. How to train for strength while protecting the back. Dr. McGill discusses how elite athletes and strength trainees can maximize performance while minimizing injury risk. Key training principles: prioritize technique over heavy loads. Poor form increases injury risk. Use compound movements that promote spinal stability, e.g. deadlifts, kettlebell swings. Incorporate single leg exercises to improve balance and core control. Vary training loads and intensities to prevent overuse injuries. Exercises to be cautious with, especially for those with a history of back pain: sit-ups and excessive spinal flexion movements, high-rep Olympic lifting without proper bracing techniques. Key takeaway: building strength without compromising spinal health requires intelligent programming, proper bracing, and movement control. Rehab and recovery strategies for a pain-free back. Dr. McGill outlines science-based methods for recovering from back injuries and preventing future pain. Effective strategies for rehab and recovery: identify the specific pain trigger, e.g. disc issues, nerve irritation, muscular imbalances. Use pain-free movement patterns to encourage healing without aggravating symptoms. Incorporate isometric exercises, McGill Big 3, to restore core stability. Gradually reintroduce strength training while avoiding painful positions. Common rehab mistakes to avoid: returning to heavy lifting too soon without rebuilding stability, ignoring pain signals and continuing harmful movement patterns, over-relying on passive treatments, e.g. massage, chiropractic adjustments, without addressing movement mechanics. Key takeaway: recovery from back pain requires structured rehab, avoiding pain triggers, and gradually rebuilding strength and stability. Final takeaways: how to build a strong, pain-proof back. Back pain is often caused by poor movement patterns, improper core training, and excessive spinal loading. Traditional core exercises like sit-ups can worsen back pain. Spinal stability should be prioritized. The McGill Big 3, modified curl-up, side plank, bird dog, are essential for spinal health. Proper lifting, sitting, and posture mechanics reduce injury risk in daily life. Strength training should emphasize technique, core bracing, and movement control to protect the back. Recovery from back pain requires identifying pain triggers, avoiding harmful movements, and progressively rebuilding stability. McGill concludes that spinal health is achievable through proper movement, targeted strengthening, and daily habits that support a pain-free back. By focusing on stability rather than excessive movement, anyone can build a resilient and strong spine. That's a wrap on Dr. Stuart McGill, Build a Strong, Pain-Proof Back. If you found this summary valuable, make sure to follow, subscribe, and come back for more in-depth breakdowns of content.